Mwenzi Welter Dinakashiku, a 200-level student of healthcare management/nursing in Jpts Institution of Management, Science and Technology. I'm here to talk about a 10-paper presentation which says the effect of doctor-nurse relationship on patient care. First of all, what are healthcare teams? Healthcare teams consist of various disciplines. We have the most common, which are the doctors and the nurses. Then we have others like we have the physiotherapists, we have the lab scientists, we have the management staffs, and we have the pharmacists. Now, I want to talk of who are nurses, who are doctors, and who are patients. Nurses are professionals who have been educated and trained to care for the sick or disabled patients. Nurses are essential parts of the healthcare professional who through education are compelled to give care to people who need treatment and care. The roles of nurses in the past, the nurses are expected to follow the doctor's instructions without interference, while nurses today are trained and empowered to take more larger roles in the healthcare sector. Who are doctors? Doctors are medical practitioners who care and treat patients and have responsibility in therapeutic intervention. Doctors, they diagnose, they treat illness, and they help save the patient's life. Then who are patients? Patients are people who need treatment and care for the healthcare providers. The original word for patient, which of patient means suffering. The meaning of patient means suffering. They come to the healthcare providers for care when they are sick, when they feel any discomfort in their system. They do come to the health practitioners for help. Now let's talk about the relationship between the doctor, the nurse, on the patient's care. Number one relationship between the nurse and the doctor relationship on the patient care is communication, good communication. The nurses and doctor relationship depends on communication in a hospital setting. Communication between the doctor and the nurses requires skills to work together or with each other for the patient's care. Skills such as listening to others without interrupting, using fragile expression, using body languages, communication style, and respect each other's opinion in the hospital setting. Number one, we have positive communication. Good relationship between the doctors and the nurses can help improving the patient outcome. Therefore, understanding between the nursing and the doctors leads to more essentially handling the patient's condition during intervention and treatment. Relationships that were based on respect between health practitioners have a positive effect on the patient. Now let's talk about a negative communication skills. Negative communication between the nurses and the doctors sometimes leads to catastrophic mistake against the patient, such as medical error. It is important that communication occurs in most of the healthcare areas between professionals, especially in complex areas such as emergency departments. ED, they have most communication between the nurses are ED and are verbal. In conclusion, the doctors and the nurses should try as much as possible to settle their differences within them. Having differences between them can cause a lot of effect on the patient's care and on the patient's condition in the recovery processes. I'm here to say that when a nurse and a doctor have differences, they have to settle it to give the patient a good care. They should have a better sector of medical institution in order to give the health a good health to the patient and collaborate and work together. Thank you.